Welcome teachers and new faculty and staff to another wonderful year at JSerra. I am Maureen McCarthy, your nurse, and my goal is to keep the students in class and the staff healthy. I need to go over a few things with you, especially those who are new to our environment. So let's start with the first aid kits. Each class has been given a first aid kit. The kit provides some first aid supplies in the event of an emergency or bandages for minor issues for students during class periods. You need to place your kit in the classroom where it is readily accessible. The kit contains a couple of items that are very important. First, we need a name placard. That goes in the kit. The other thing is your room placard. And the third thing is we have a student accountability form that needs to be, a couple of them need to be in your first aid kit. In the event of an emergency and the buildings are being evacuated, take students to the designated area outside the building on the tarmac. Once there, take roll and write down the names of those missing of the students on the accountability form, would be this form. And that should be coming from your roster that you would have in that class that's designated specifically for that class. They will be collected after the emergency and/or drill by somebody who will be coming around picking them up. Let me go through the procedure in an emergency. The teacher is the last person to leave the room. You shut your door, but you do not lock your door. This is in the event that search and rescue will be able to get in and rescue anybody that is in your room. But if it's locked, they won't be able to do that. There's two things that you need to remember once you exit. If you know there are no students left in your room, you will put a green hanger on the door. If there is a student who is left in your room who cannot move and they cannot be moved, you would put a red hanger on your door. The red hanger or the green hanger alerts the search and rescue person to see if somebody is left in the classroom and needs to be rescued out of the classroom. Now, my next item is in regards to sending a student to the nurse's office. We have special passes just for the nurse. They are red. These passes alert me that there is a child who's sick. Each classroom will be assigned 2 of these. They are only to be used for students that need to come to see the nurse, not for any other reason. Please do not send them with the students to any other department to see the counselor or anything. That's strictly to see the nurse. After I see the student, I will place a sticker on the nurse pass with my initials and time on it. I encourage the students to go to class first to get this pass and then come to the nurse so they will not be counted tardy. Sometimes they will come in between classes and it will be because they're feeling nauseated and I don't want to send them to class. If that's the case, I will send them back to class with the green slip letting you know the time. And either way, you will know the time when they leave my station. These nurse passes will be delivered to your classroom and there will be 2 per classroom. Also, many of you have had your hand sanitizers and your Kleenexes delivered to you. Some of you had your doors locked. And if your room didn't get one and you need one, please come down and get one. We also have Kleenexes in the faculty lounges. They are in each building's faculty lounge in a designated cupboard if you ever need extra Kleenexes. Keeping the staff healthy is another important aspect for me. I'm here for your needs. This year I'll be putting together a medication box for you in a designated area in each of the buildings. They look like this and they contain the following medications. They contain Tylenol, Advil, Benadryl, Claritin, Tums, and Sudafed, and some bandages, and they also have Pepto-Bismol. Many of the medications have a generic name, so you'll see it here. But this you can go ahead and help yourself to whenever you're in need and feeling sick. There's a few disease processes here that are very important and you need to know about. First of all, we have 5 type 1 diabetics. Diabetes is a very complicated disease process, and the following video would be a good thing for you to be able to watch and see what you can do in case you have an emergency with a diabetic, and also to understand diabetes better. When you have a diabetic in your class, which I will let you know who that is, you are never to send them to this nurse by themselves. They always have to have a buddy. And the reason for this is if they ever get too low in their blood sugar and they have a seizure on the way, it would be very long for us to be able to get to them. When you have a diabetic student, they will be carrying many of them carry their own supplies. They're either on a pump or they carry their own needle supplies. And when they're feeling low, they will medicate themselves in class with sugar. So please allow them to be able to do that, just as a reminder. And now let's look at this video.
So I bet you're curious. What is diabetes?
An organ in your body, called the pancreas, produces an important hormone called insulin. Insulin is what turns the food you eat into energy, and we all know how important energy is to kids. But my body doesn't make any insulin, so when I eat, the sugar in my blood never turns into energy. The blood sugar levels just get higher and higher with no place to go.
If left untreated, I could be at risk for organ damage.
To my heart, liver, kidneys, and even my eyes.
But don't worry. Luckily, there are ways I can add insulin to my body and keep my sugar levels normal, just like yours.
Throughout the day, I check my blood sugar levels using a glucose meter. You may see me doing this in the classroom before I eat or begin any kind of strenuous exercise. Checking or testing involves taking a drop of blood, usually from my fingertips, and placing it on a special test strip in a glucose meter. Blood sugar levels are measured in milligrams per deciliter, and normal for someone with type 1 is usually between 80 and 180 milligrams per deciliter.
Once I test my blood sugars, I know how much insulin I need to give.
Kids like me usually need insulin shots several times a day.
The exact number varies from person to person, but we take them at regular intervals every single day.
Some kids use shots or insulin pens. It can hurt, but you get used to it.
I use an insulin pump.
It's the size of a cell phone, and I just slip it in my pocket.
The pump gives me a small, steady dose of insulin through a plastic tube, which is attached to a small needle inserted into my skin. When I eat, I just push this button, and it gives me an extra amount of insulin. The insulin I inject goes into my system and helps my body change food into energy.
Now look, don't be afraid.
The most important thing you can do is stay calm and help me find a solution.
Here are some of the symptoms that tell you my blood sugar levels are too high. Thirst, frequent urination, blurry vision, stomach pain, increased hunger, nausea, drowsiness, lethargy, or exhaustion, confusion, sweating, fruity, sweet, or wine-like odor on my breath, vomiting, inability to concentrate, and/or weight loss. High blood sugars in the short term won't put me in danger right away, so if you see these warning signs, don't panic.
But if my blood sugar is high for an extended period of time, then we've got a major problem.
Because of my diabetes, I have an emergency care plan that tells you what to do if I experience any problems relating to my blood sugar levels. It was prepared by my healthcare provider in conjunction with my family and school personnel. If I am experiencing high blood sugar levels, the plan may instruct you to give me water or sugar-free drinks, monitor my blood sugar levels, and keep me from engaging in strenuous exercise.
If you recognize my blood sugar levels are extremely high, immediately call my parents or a physician. Please don't mess around with it yourself.
You should only inject additional insulin if specifically told to do so.
The other problem I have is low blood sugar levels.
Low blood sugars in the short term are much more dangerous because they can lead me to insulin shock. Low blood sugar levels occur when I have too little food or too much insulin in my system. Here are some of the reasons why I may have low blood sugar levels. Taking more insulin than needed for the type of food I ate, not eating or eating later than usual.
Here are some symptoms to look for if you think my blood sugar may be going low.
Dizziness, nervousness, personality change or irrational behavior, blurry vision, shakiness, nausea, crying, sluggishness, sweating, poor coordination, hunger, lightheadedness, irritability, drowsiness, erratic response to questions, inability to concentrate. If I tell you I don't feel well or that I think my blood sugar levels are going low, never ever send me to the nurse's office or anywhere alone. Always make sure I have someone to accompany me. It's important to refer to my emergency care plan and monitor my blood sugar levels as the plan suggests. You should always take action based on the readings and not just on how I may or may not be acting. Low blood sugar levels are considered anything below 70. In this range, Some kids will start to show symptoms, while others may still feel perfectly normal. If there is no way to test my blood sugar level to see if it is high or low, always treat me as if it's low. Feed me. Give me something to eat or drink that contains carbohydrates or fast-acting sugar, and then test my blood sugar level as soon as possible.
But if I start showing some really serious symptoms, you might need to give me a glucagon shot. Glucagon is something you need to give me if I can't eat food or drink liquid anymore.
If I start to shake, lose consciousness, or experience convulsions, lay me on my side. This will keep me from choking or hurting myself. Call the person trained to give me an injection of glucagon or call 911. Glucagon, like insulin, must be injected with a syringe into the skin. Glucagon is packaged in a kit. It comes with a vial of powder containing the medicine and a syringe filled with liquid to mix with the medicine. You should never mix glucagon in advance or after the expiration date printed on the kit and on the vial. Once you have administered the glucagon, it might take up to 10 minutes for the shot to cause the blood sugar to rise and the person to respond. Once conscious, you should monitor blood sugar levels and encourage the person with diabetes to eat or drink something with carbohydrates as soon as they are able. After mixing glucagon, always discard any unused portion.
Handling situations like these can be very scary. Believe me, I know.
But by reviewing the signs and symptoms regularly, you can prepare yourself in case there is an emergency.
Asthma is another area. It's 10% of the population is asthmatic across the nation. Many of that varies. It could be exercise-induced. It could be because of fragrance. It could be just that they have a very bad proclivity to having asthma. So let's watch this following video so that you get a little better acquainted with what you need to do with that.
Asthma is a common healthcare problem. About 2 children in every classroom of 30 have asthma. Asthma is the #1 cause of absenteeism due to chronic illness. It interferes with a student's ability to participate in school activities and can even cause a medical emergency. But with an improved understanding of this illness and its management, school personnel can help the student with asthma participate more fully in school activities and lead a happier and more productive life.
Everybody who's involved in the child's care needs to understand about asthma, and that includes the child, him or herself, the parents, the people at school, and of course the healthcare providers.
Asthma is an illness that primarily affects the airways, the tubes through which air flows into and out of the lungs. Asthma has episodes of airway narrowing or obstruction caused by 3 factors: temporary contraction of the muscles of the airways, immediate swelling or inflammation of the tissues in the airway walls. The swelling in turn creates more swelling and increased sensitivity, and clumps of mucus that may become lodged inside the airways. Although the episodes of asthma or an asthma attack may come and go, it is now known that asthma is a chronic condition. Even when a person feels fine, there is underlying inflammation making the airways sensitive to a variety of things. The things that make asthma worse, that is, cause an asthma episode, can vary from person to person. Some common things are allergies to pollen, household dust, animals or mold, respiratory infections, colds or flus, exercise, irritants such as cigarette smoke, secondhand smoke, perfumes or air pollution, and cold air and changes in weather. It is very important that children use their inhaler properly. This procedure can be very tricky because it requires coordinating breath inhalation with medication release.
Kids should be able to take part in sports, and kids should be able to take part in all school activities if they're receiving the right treatment.
Asthma in and of itself is something that we can do something about. There are so many medical problems that we can't do anything about. But asthma, that is something you can deal with. You can actually change what's going to happen for that child through an education program.
Allergies and EpiPens. Allergies can be very disconcerting many times. If you've ever seen a child who's gone into an anaphylactic reaction, it is very scary. Many of the students who do have allergies will either have them in a couple of different areas. They're either to bees, food, like peanuts, and sometimes the worst ones can be from airborne issues of peanut allergy, which is a very disconcerting one because we don't know when that will erupt on anybody. So those kids that have EpiPens, you will be aware of. I will let you know who those are. And they should be able to carry an EpiPen with them. And I also have extra EpiPens in my office. If you ever call for an emergency, I also have EpiPens on me whenever I come to the emergency. Let's watch this film on how to give an EpiPen and what you can do in the case of an allergy emergency.
Today, doctors are seeing more and more children with allergies, especially food allergies. In a room of 20 kids, one or more of them will have allergies. While most allergic reactions result in merely uncomfortable symptoms, some anaphylactic reactions may be more serious and even life-threatening. About 150 children and young adults die from food allergies every year in the United States. Due to the unpredictable nature of allergic reactions, over 2.4 million epinephrine autoinjectors, such as this, are currently being prescribed. EpiPens deliver medicine quickly and effectively, but they only work if there is somebody around who knows where the pen is, when to use it, how to use it, and will actually do it. Times when you need to use an EpiPen can be stressful and may even be life-threatening. So it is important to have a plan of action so you can calmly react to the situation. Knowing when to use an EpiPen can be easy. If a child eats something they're allergic to, has hives, and is wheezing, give the shot. Sometimes, however, symptoms may not be as obvious. So if you are in doubt, always give the shot. You may not even have known what the child has eaten. But if you do suspect an allergic reaction, or a child is demonstrating 2 or more symptoms, don't wait. The longer you wait to administer an EpiPen, the harder it is to stop an allergic reaction, mild or severe. And allergic reactions can change from mild to fatal quickly. No child has ever died or has had serious problems from a standard dose of epinephrine. To protect the child in your life, be prepared. Memorize these steps and practice them. If you get it, call it. Take the EpiPen out of its case. Hold it in a firm fist grip. Remove the cap. Make sure the child is sitting or lying down. Identify the big muscle in the thigh. Hold the leg and the child steadily. Press the orange part firmly against the thigh so that it clicks. Stay there. Don't bounce. Hold for 10 seconds. Press, click, and hold. Some of you may have an epinephrine injector that looks like this. This training device has yellow caps, but yours may have a different color. This has the same medicine as the EpiPen, the same kind of spring-loaded needle, and is used for exactly the same reasons. This injector has 2 safety caps. Hold the injector in a fist grip. Don't put your thumb on either end. Remove both safety caps. The red end is the action end. That's where the needle comes out. Remember, red to the leg. The red end should not touch anything else. Again, make sure the child is sitting or lying down and hold for 10 seconds. For this device, the needle will remain exposed after use. Please put it down carefully or put it back in the case. And if you haven't done so already, call 911. As with any emergency medication or device, please be familiar with it before you need to use it.
Seizures is another area that can be very scary when you see one. However, we don't have at this point very many students with seizures here, and if they do, I will let you know who that is for those who are on an as-need-to-know basis. Let's watch the following video in case your student has a seizure.
It's much more common than most people appreciate. Somewhere around 1 out of every 100 people in the United States has epilepsy right now. And somewhere between 3 and 5% of the population has had a seizure at some point in their lives.
Some people call epilepsy or seizures a brainstorm, a storm in the brain. But what does that mean? Well, it means that this normal activity where the cells are signaling from one to the next, is basically doing it in an uncontrolled way. So it keeps going and going and going. Depending where in the brain that activity happens, your seizure looks different. It could be a repetitive thought. It could be a vision. It could be a smell.
It can also be the classic thing that people tend to think of when they're thinking of seizures, and that's the tonic-clonic seizure, or what we used to call the grand mal. It can also be, on the other side of the coin, what we used to call petit mal, where all we're seeing is an absence of a person. They just go blank for a moment, stare off, maybe a little bit of movement. And so we have the huge range from the biggest, the strongest, the most worrisome for most people, the grand mal or the tonic-clonic, all the way down to a little bit of movement or simply staring.
More than 300,000 students in the U.S. live with epilepsy. Working in the school system, chances are you'll encounter a student having a seizure.
When he started school was the biggest fear of my whole entire life, not knowing when you were going to get that call.
And then she started having a seizure. We were pretty scared. So I sent some students down to the security office. I sent another student to another room to hit someone else's security button, and I tried to call the clinic. The clinic went directly to voicemail.
Attempting to get help is the right thing to do, but how can a teacher assist while waiting for help to arrive?
The first thing they should do is make the child safe. And so that involves making sure there isn't something near the child's head in particular, okay, that could produce some danger.
The next thing you do, if the person has glasses on, you want to take them off, loosen their clothing. If you can ease them to the ground, allow them to go to the ground, and then turn them on their side.
It's helpful to do that because what's often happening, and it makes people very scared, is that you hear guttural sounds, as though they're having trouble breathing. And so what you're trying to do is to allow the head to turn to the side so the saliva, okay, which the person isn't able to swallow at that time, can come out of the mouth.
You will want to get help. In the school rooms, they have buttons that you can push to get help. You can ask someone else to go get help. Call the health room. And if this is someone that's known to have seizures, they'll come with an individualized care plan, which will say if this person has medications or not.
Things not to do are to either put something in someone's mouth or think that they're going to swallow their tongue. The tongue is actually attached to some pretty big muscles in the throat. And so while patients may bite their tongues, they aren't going to swallow them. The more dangerous thing is that if you put something in someone's mouth that's rigid, they may crack a tooth. If it's something that's soft and they could potentially bite off, then the part that they bite off may actually be aspirated or go into their lungs.
Safety, clear the environment, roll them to their side, and then just stay with them and allow it to run its course. There is nothing that a person can do to change the course of that seizure.
In many cases, however, students with epilepsy do not have learning disabilities, and a supportive school system can ensure that students with epilepsy thrive in every way that kids do.
I think one of the things the school system has to help in, people's friends have to help in, families have to help create, is a situation that says 99.9% of the time your brain's fine. There's nothing wrong, okay? You can do anything you want to do. And I think in knowing that and in understanding that, I think we wind up with young people who grow up to be everything that they were meant to be.
Children with epilepsy should be able to participate in most school activities. They should be able to go on field trips, they should be able to engage in extracurricular activities, and they certainly should be able to engage in sports.
At school, Jake had a seizure in PE and the kids caught him before he hit the ground. That's what it's all about. It's all about people, you know, knowledge is empowering and it'll protect all of us.
I am not different than any other kid.
Epilepsy, schmepilepsy. That's the way you should look at it.
Don't start treating me differently. I'm just the same person with a minor addition.
Okay, regarding field trip forms, anybody who is taking their students on a field trip, that includes any teachers or magnet programs, I need the field trip form signed by the parent and sent to me 2 weeks before the trip. That way I can look up their medical issues and fill out any paperwork that you need. I also provide for you a first aid kit or backpack that will have first aid supplies in it for you that you can take on your trip. If you intend to give medication during that trip, then I need you to stay tuned, and we'll do another video that can help you clear you and give you assign you to be able to do that this year, since you are functioning actually under my license. The other area is elevator passes. Elevator pass is automatic if a student is on crutches. So I don't usually give an elevator pass for them. However, if there is somebody who has a special boot or a special ACL repair and they're off of their crutches, then I can give them an elevator pass. Or if there's a problem with equilibrium or something, then I'll have an elevator pass. That's in the past has been red colored. A blue bathroom pass we are now making up for students with irritable bowel syndrome that need to be able to let you know that they have to go to the bathroom immediately and not have an accident in class. Unfortunately, that can happen. So I will inform you who needs to be able to use that blue bathroom pass. The last area that we have to discuss is on concussions. Concussions have been a big issue in the last couple of years, especially due to sports and the laws that have come out to guard against students playing in further sports until they're cleared. When I have a student with a concussion, or I find out there's a student with a concussion, we have them send a plan of care to their doctor, and the doctor sends a plan of care back to the school, to the nurse, and to the trainer. I put out an email to that teacher letting them know that the student has a concussion and what the academic accommodations may or may not be. This will also be in conjunction with the student's counselor, guidance counselor. If you have any questions about that, please email me on my private email and let me know. Otherwise, this will have to take a course of action through follow-ups with the doctor and plan of care over a period of time. If you have any questions on anything in the last couple of minutes that we've gone over, please call me, and my extension is 1105, or email me at any time. I look forward to working with you in another year of good health and happiness. God bless to everybody. Thank you.